Most of us assume that the reason that 30 million Americans have diabetes is directly related to sugar consumption and obesity. New research calls that assumption into question. Consider this: dramatic increases in sugar consumption predate the diabetes epidemic by 40 years. If eating more sugar was the sole driver of diabetes, this epidemic should have arisen much sooner. It would be wrong to claim that dietary choices and obesity are unrelated to diabetes. There's certainly a connection, but new research shows that environmental toxins play a large role in the epidemic. Obese people in the bottom 10% of toxin load do not have an increased risk of diabetes, while 30% of lean people with a high toxin load will develop the disease. 90% of diabetes cases could be attributed to a massive increase in toxic exposures to chemicals like arsenic, phthalates, polycyclic aromatic hydrocarbons, and BPA, a chemical that, despite efforts to minimize its effects, is still widely in use. In 2012, the FDA banned BPA in baby bottles and sippy cups because research showed that the chemical is linked to cancer, impaired immune function, early onset of puberty, obesity, hyperactivity, and diabetes. Unfortunately, BPA continues to be used in the production of certain plastics, many consumer goods such as food and drink packaging, cash register receipts, water bottles, implanted medical devices, and many more. BPA blocks insulin receptor sites and causes insulin resistance, which in turn leads to diabetes and obesity. Researchers have found BPA in 90% of Americans tested, demonstrating that FDA is dramatically underestimating our exposure to this toxic chemical. And some experts claim that absorbing or ingesting the ubiquitous chemical may harm people at doses 20,000 times lower than what the FDA says is safe. And keep in mind that chemicals meant to replace BPA, such as BPS, are likely just as dangerous. Using glass rather than plastic is the safe option. Stand with ANH in the fight against diabetes and obesity and demand that FDA ban BPA completely.